Alright everyone, so this training is going to be for Medicare enrollment periods. Medicare enrollment periods are very important because that's pretty much the only time when someone can sign up for Medicare, sign up for Part B, Part C, Part D, or Medigap insurance. So without one of these enrollment periods, it will be, well, it's impossible for you to enroll them in a plan. Also, it's impossible for them to get health insurance in some cases. So Part B enrollment periods, there's actually 3 Part B enrollment periods. The first one is Part B IEP. That's pretty much when you first become eligible for Medicare at age 65. And we'll go into each one now. So Part B IEP, you must actively sign up for this unless you are currently collecting Social Security. If you're on Social Security benefits, you will automatically be sent in an enrollment packet, and in that enrollment packet, it will have your Part B start date. So the only time the only time you actually have to do anything is if, let's say, one spouse is still working and the other is retired and collecting Social Security. In that case, the person who is collecting Social Security, if they're covered by their spouse on their insurance plan, then the instruction would be for them to return the Part B card to the Medicare and then delay Part B. Now, many times people will always just say you might as well sign up for Part A because it's free. There's one instance where signing up for Part A is not a good idea, and that's if you have, or your employer group or your plan has an HSA attached to it. That's a health savings account. Signing up for Part A or Part B makes you ineligible for an HSA. So for those folks who have an HSA and sign up for Part A, their HSA has to be prorated based on their enrollment date into Part A. And that can be really confusing because if you sign up for Part A after you turn 65, your Part A will actually backdate 6 months. And that again would cause you to be partially tax-wise, you have to make some adjustments on your prior tax return. You could. Again, some of the weird things is if you sign up for Part B during your IEP and you do it after you're 65, you got those 3 months to sign up. If you do it after you turn 65, your coverage actually starts 3 months after that. And if you do it 1 month after you turn 65, your coverage starts 2 months after you sign up. And if, of course, you sign up on the age or the month you turn 65, your coverage starts on the next month. So make sure if you have any clients or you yourself who needs to sign up for Part B, make sure you sign up before you turn 65 to make sure that it starts exactly on your birth month and you don't potentially lose out from having Medicare and being ineligible for both the ACA marketplace plans and Medicare during this transitionary period. Okay, so one of the strange things about Medicare Part B is if your birthday is on the 1st of the month. If your birthday is on the 1st of the month, you actually can sign up for Medicare, or Medicare coverage can start the month before your birthday. So for an example, if your birthday is June 1st, when you turn 65, your initial enrollment period actually begins in February instead of March and runs till August. So therefore, if you sign up for Medicare between February, March, or April, your coverage will actually start May 1st instead of June 1st. So the next type of enrollment period for Part B is the general enrollment period, and this is the one that begins January 1st and extends to March 31st. This is for people who miss their initial enrollment period, and this generally people who enroll in the general enrollment period have a penalty, and this is because they missed their enrollment period. Remember, for this one, coverage doesn't begin until July. So if someone lost their coverage on let's say they didn't have any Part B and they didn't need it because they only went to the hospital and they're really healthy, and they say, hey, I don't want to pay for something I don't need. If they were required or if they needed outpatient Part B services and they wanted to enroll, they would have to, number one, enroll in the first 3 months of the year. And even if they did that, their coverage would not begin until July. And then, of course, there would be assessed a penalty, which is shown here. And it's 10% per 12-month period that you have not signed up. So the most common type of Part B enrollment, I think anyway, is the special enrollment period, especially for people in Hawaii who work beyond their 65th birthday. And this enrollment period lasts for 8 months after the employment ends, and you can actually enroll in Medicare Part B anytime that you are actively employed. So even if it says it lasts 8 months after employment, the special enrollment period actually is the entire time that someone is actively employed or covered under a spouse who is actively employed. In order to sign up for this, you'll actually need a couple forms, but before we get into that, just to clear up some of the misunderstanding I get a lot, is retiree and COBRA are not considered eligible for this SEP. So people who have the federal retiree plan and do not have Part B, if they leave that plan, they do not have a special enrollment period. And also if someone has COBRA and COBRA ends, they do not have this special enrollment period for Medicare Part B. So the two forms you need is, the first one is Form CMS 40B. This is to begin Part B, to start it. You don't need the witness signature. That's only if the applicant is either blind or has some sort of disability. And then in the remarks section, that's where you would indicate when you want your Part B to start. For example, if I'm retiring in July and it's May, I can say start my Part B in July or in August, depending on when that coverage date for the group plan is set to end. The next form you're going to need is Form CMS L564, and this is the form that verifies the employer plan validity and the verification that this person did have a credible coverage plan. And it must be completed by the former employer. They actually have to sign. They could submit this electronically, or most likely they'll be faxing it or mailing it. And keep in mind that every single company that this person worked for from the time they were 65 until the time they apply, if that company provided health insurance, they will have to fill out one of these so that there's no break in coverage. All right, Part C and D enrollment periods. So Part C and D are Medicare Advantage and Medicare drug plans. So Part C and D share 3 enrollment periods, and that's the IEP, the ICEP, and the AEP. Part C has an open enrollment period that's separate, and Part C also has a special enrollment period for low-income subsidy beneficiaries and people who have both Medicare and Medicaid. So here's the list of the Part C and D enrollment periods. The initial enrollment period, that's when they're first new to Medicare. They have 3 months before and 3 months after to sign up for a Medicare Advantage plan. The initial enrollment period new to Part B, that's for someone who is just joining a Medicare Advantage plan without drug coverage or with drug coverage, and this is anytime they're new to Part B. So if they have a different Part A and B start date, you would use this initial enrollment period, but you would need to use the ICEP form I know it's confusing because they only have IEP here, but you need to use the ICEP form, and this is used when parts A and B dates are different and it's their initial sign-up date for a Medicare Advantage plan or a Part D drug plan. The next is the open enrollment or annual election period. Again, Medicare itself does not do a good job in keeping their messaging consistent. Open enrollment period is, in our minds as agents, should be this period here, January 1st from March 31st for Medicare Advantage, and this period should be annual enrollment period for us agents. People, Medicare beneficiaries, because of their inconsistency here in messaging, they sometimes will interchangeably use the words, but that's okay. It's pretty much the only reason why we need to know the exact acronym is when filling out applications or using or coding our electronic applications to make sure that we get the right code to make sure the application processes correctly. It's not necessary to educate your clients into the different things because Medicare itself isn't very consistent either. And the last one is for special enrollment period, and that's for people who have Medicaid or extra help. And one more thing for that special enrollment period, if someone moves, they have 60 days from the time that the date address change takes place to change their Medicare plans, and they can change their drug plan and or their Medicare Advantage plan during this time frame. So Medigap or Medicare Supplement. Medicare Supplements have two primary enrollment periods, and that's their Medigap OEP and the guarantee issue. So for the Medigap OEP, that's during the first 6 months after Part B is effective. You can pick any Medigap plan letter without underwriting. Again, it begins when the Part B coverage starts and lasts for 6 months. Medigap guarantee issue rights, there are 7 times outside of the Medigap OEP where you do not need underwriting for a plan. Typically the problems with this is they can only qualify for either a plan F or a plan G. The rates may be higher, and for us agents there's most likely going to be little to no commission on this sale. And the primary reason for this is these people who have guarantee issue rights are typically folks who have very expensive medical conditions. And therefore Medicare makes them buy the most expensive plan available. And the Medicare insurance companies know this, and they charge the most expensive rates for these types of plans. In Hawaii, United Healthcare and all the plans pay very low commission on this, typically 1%. It's almost like just getting a finder's fee or something really minimal for doing the service. I would suggest, if at anything, apply for underwriting first, and then if they do not pass underwriting for health reasons, then do a guarantee issue. And what this does is it gives your client the ability to choose any plan if they qualify for underwriting. I actually have them enroll in their OEP, especially with my clients in other states, if possible, just because the OEP gives them access to all the plan letters, and also sometimes the guarantee issue rate can be higher. It can be the higher rate of the plan choice. And what could happen with the guarantee issue is that they require information from the prior health insurance company in order to get a guarantee issue. They need the termination letter from the health plan, which can be an additional step in getting this approved. So they could potentially not have insurance for a little bit if the prior insurance company doesn't provide them a letter. Now, this can be avoided if you can get everything in advance, but it's very difficult to do that, especially since you yourself cannot request those documents. All right, well, that's everything for Medicare enrollment periods. You can watch this video again if you need clarification on anything. All the slides, information was taken from the Medicare.gov website. So for more clarification, you can go ahead over there. And of course, the Medicare New Guidebook is always the best place for the wording, messaging, verbiage, whatever you want to call it, that Medicare gives out to the beneficiaries that we should also be using, so we can talk to them in the same kind of tone and words that Medicare uses, so we can sound consistent in all the messaging we provide.